If your doctor told you that you have a short cervix, it can sound scary because it's linked with preterm birth.
But the good news is, when caught early, there are effective treatments. What is a short cervix?
The cervix is the gate of the uterus that stays closed and firm during pregnancy. A short cervix means the cervix is shorter than expected and may open too early.
Doctors measure cervical length using a transvaginal ultrasound. It's the most accurate.
You may hear numbers like 25 millimeters or less, especially before 24 weeks, may be considered short. Your doctor will interpret it based on weeks of pregnancy plus your history. Why does it happen?
Risk factors. Short cervix can happen with no symptoms and no clear cause.
Risk is higher if you have previous preterm birth, previous cervical surgery, like LEEP cone biopsy, uterine abnormalities, multiple pregnancy, twins, triplets, previous second trimester loss. Symptoms, often silent. This is important. Most women feel nothing.
But possible warning signs can include new pelvic pressure or heavy feeling, lower backache, mild cramping that doesn't go away, increased watery discharge,
spotting or light bleeding, regular tightening, contractions. Seek urgent care if you have painful contractions, bleeding plus cramps, fluid leakage, reduced fetal movements, later weeks. Treatment options. Treatment depends on cervical length, pregnancy week, and your history.
1. Vaginal progesterone. Often used when cervix is short, especially before 24 weeks.
It helps reduce inflammation and lowers the risk of preterm birth in many cases.
2. Cervical cerclage stitch. A cerclage is a stitch placed to help keep the cervix closed. Usually considered if cervix is very short early, or you have a history of preterm birth second trimester loss, or cervix is opening funneling dilation.
3.
Monitoring.
Some cases need close follow-up ultrasounds every 1 to 2 weeks. 4. Lifestyle, precautions, doctor-specific. Your doctor may recommend reducing strenuous activity, avoiding heavy lifting, and sometimes pelvic rest, but advice is individualized. 5. If contractions start.
Doctors may use medications to slow labor and give steroids to support baby's lungs if delivery risk is high.
Delivery outcome plus reassurance.
Having a short cervix does not mean you will deliver early for sure. With progesterone, cerclage, and close monitoring, many women reach a safe full-term delivery.